Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Pathology edition. This audio podcast is part of the Type 4 squad. This audio podcast is part of the Ty4Phoon Twixzter. This is an audio podcast as part of a Storm Robotics production. In this audio podcast, part of the Pathology edition, there'll be some conclusions and some recommendations. In around where the series had delved into and looked into a systematic review and a systematic review of a systematic review looking at healthcare scientists and primary care, and looking at the systematic review, peer review works from 2020, and so. And so, in around the sort of conclusions and recommendations in this as part of this works, the in the United Kingdom, there's been a sort of a continuing and important shift in the burden of disease from mortality to morbidity. Much of the burden to more more to much of the burden much of the burden be much of the burden be that morbidity or mortality is preventable. Um, the the in around monitoring around particular diseases in context of primary care, and could be delivered where there's more involvement or involving healthcare scientists, or at least from an educational or supplementary capacity, and where investigate and wherein investigations around reducing unnecessary test requests and streamlining particular disease pathways or cross particular disease pathways, and where referrals are concerned, this could also support, especially where clarity on timing of test requests and quality assurance in context of pathology of investigations are required. In around the recommendations. So, number one, healthcare scientists with expertise could be provided could with expertise to be provided to be involved or provide to be involved, but provided sort of further training and qualifications, where applicable, for example, and if wanting to consult with service users and patients and the public through for example, digital platforms, and two in around professional organizations to prompt guideline and practice for healthcare scientists, to gain additional certification to provide sort of an educational basis, for example, to provide sort of as certification regarding and relating to scientific expertise in context in context of service provision. And C, allied health professional collaborations, or HP collaborations, are also required to prompt online group consultations, for example. And this is especially important when focusing on the hard to reach, but on hard to reach populations as well. So, in around the summary of this peer review works from 2020, involving healthcare scientists in primary care on how to monitor disease trends, providing patient-centered understanding or patient or service user centric understanding needs contemplating owing to disease burdens and in around disease burdens and also in around other aspects of disease implications, and this avenue could open doors to involving scientists, more healthcare scientists, more on the front line supporting care, more so for service users or patients with long-standing conditions, and therefore there is a requirement or a need to review the current healthcare scientist workforce in the United Kingdom and the advantages and sort of the analysis and the analysis for these healthcare professionals being available for service users service users and patients in primary care. So that draws this audio podcast to a close. This audio podcast has been this audio podcast of this series has looked at works from peer review works from 2020 and from 2020 and healthcare scientists and primary care, where this works with peer review works in context of a systematic review. This paper, the peer review works, was published in the American Journal of Biomedical Science and Research and is available online and is available through the this work is available, or the peer review works is available through the Renal Patient Support Group, the RPSG, and online through social media. Online and through social media, there will be a list of references or citations that listeners are welcome to check out to identify works that are similar to this peer review works as well. So thank you for tuning in. This has been an audio podcast looking at peer review works. This has been an audio podcast as part of a pathology edition, part of the Type 4 squad, and part of an audio podcast, part of the Ty4Phoon Twixzter, and this has been an audio podcast as part of another Storm Robotics production. Thank you.